So welcome and thank you for coming tonight. My name is Beth McCrave and I'm a parent and a board member of the NEA BPD, which is the National Education Alliance for Borderline Personality Disorder. And I'm also a trained Family Connections class leader. And Dr. Herbstman has kindly given us a few minutes to tell you about the Family Connections classes that are run by the NEA BPD. So Family Connections is a 12-week evidence-based manualized class. It's for family members of people who suffer with severe emotional dysregulation or borderline personality disorder. The class is taught by trained family members. Family Connections was developed by Drs. Perry Hoffman and Alan Frazzetti, and there are three main goals of the class. One is to provide education, current information and research on the disorder. A second goal is to teach and practice skills that are informed by DBT. So we teach many DBT skills such as relationship mindfulness, validation, and radical acceptance. We also provide a network of support. So for many of the family members, the class is the first time that they experience other people who truly understand what they go through on a daily basis. And from my own experience with it, that's very impactful, both for the participants and the leaders. Family Connections has been shown in 3 studies to decrease grief, burden, and depression, and increase mastery and empowerment for family members who participate in the class. We just completed a 12-week class here at McLean, and they'll be ongoing. So classes are held nationally as well as internationally, usually with a waiting list. They're also held in a teleconnections format too for people who can't make the physical class or for people who are in underserved areas. If you're interested in signing up for the class, you can go to the NEA BPD website, which is borderlinepersonality.com, and register under families. So tonight, we're fortunate to have Dr. Ben Herbstman speak for us. He's an assistant psychiatrist at McLean Hospital. He works in the Gunderson outpatient program and the Bipolar and Psychotic Disorders Clinic. He's a part-time instructor at Harvard Medical School, and he's also a third-year candidate in psychoanalysis at the Boston Psychoanalytic Society and Institute. He also has a private practice in Cambridge. So I'd like to introduce Dr. Herbstman.
I'm going to be talking about family involvement in the treatment of borderline personality disorder. And really the meat of my talk is going to be talking about family involvement. I will be speaking about how that works in borderline personality disorder, but I think that what I'm going to try to do is aim this talk at family involvement in general for someone who has a mental illness or psychiatric problem. And I think it's going to be hopefully more broadly generalized than just for borderline personality disorder or BPD. So thanks again for coming. We'll get started. So as Beth was mentioning, I wear a lot of hats here. I am an individual therapist in the Gunderson outpatient program. I do psychopharmacology. I run several groups. And I also have been working and I'm a family therapist here as well. And when I was thinking about giving this talk and talking about what is it like when when you're wearing different hats, you sort of take on different roles, and I thought, well, what role do I take on when I become a family therapist, and how am I perceived? That's what sort of made me think about it. And I think that when I thought about, okay, the family therapist hat, what do people think about when they see me in this hat? And what I thought about is, and I apologize in advance if there are any dentists in the room, but that's sort of what it made me think about. It made me think, and I like my dentist, so just a full disclosure. But I think that they oftentimes, when people come and they come into McLean and I meet them as the family therapist, they sort of think of it as like going to the dentist. It's something you probably should do. It's going to be healthy for you. Maybe not the most fun thing you're going to do that week or month, but you do it, and maybe it'll be good for you or helpful. So there are a lot of different types of dentists. There are dentists like in this book where I don't know if you're familiar with it, but the kids don't really want to go. They're frightened. The little girl gets her tooth pulled, and the dentist isn't so bad. It's sort of neutral experience, maybe a little positive. Then there's this dentist. I don't know if you guys recognize him, but this is Steve Martin from Little Shop of Horrors, where he is a very sadistic, nitrogen inhaling dentist who is someone who inflicts a lot of pain and discomfort on the people who come and see him. So this is not the dentist you want to go to. And I think sometimes when people think about doing family therapy, I think sometimes they worry that it's going to be this type of experience. So my talk today is going to be aimed at trying to explain a couple of things. The first thing is to try to explore why people are hesitant and also sort of cautious about doing this type of work. Because I think that there are a lot of good reasons why people are a little cautious. And the second one is to try to explain why and how family work is a very powerful and effective tool to positively influence your family, one's family. Talking about hesitancy. So I'd like to try to define the system that I'm talking about, that I'd like all of you to talk about and think about with me tonight. So normally, this is going to represent a patient, so a young man. So let's say we have a young man who's having problems in their life. He gets diagnosed with borderline personality disorder. He comes to McLean, we meet him, and we say, well, there are a number of different things that we can offer to help you with this. We draw a circle around him and say you could try some different treatments. There are many that are sort of effective. And we say, he is our patient. Now, thinking about it from the family therapist hat and sort of how we think about the system, we have the same patient who's come to our center. And then we say, okay, well, there's our patient, but let's think about their relationship to their mother and sort of how that impacts how they're coming to us. What about to their father? Let's look at the relationship, I'll back up. Let's do something radical and say, let's not think of that as the patient. Let's just say it's the child. And then we're going to try to look at how are the influences, how are the relationships between the mother and the child, the father and the child, the parents, affecting why this person is coming to us and what some of the problems might be. And we draw a big circle around that and think of it from the family system is sort of what we're trying to hold on to and navigate and look at. So for good reasons, I think that this can be a threatening thing, a scary thing, and a difficult thing for people, anyone to do. So, and that's sort of this is kind of the simple version, because most families, I shouldn't say most, but a lot of families, there's not one child. So then you think the same child or young man who's coming to us, and we have a mother again, we have a father again, but then let's throw in a sister. And then when you start to look at all the relationships that are happening in this system, all of a sudden it gets a lot more complicated. So this is, I think, very important to look at, because I think a lot of things a lot of dynamics end up getting played out within a family system that can not only affect the person who's coming in, but I think that a lot of times when someone comes to McLean, a hospital, when someone's having this degree of problems, it's not only the person who's presenting who's really having a hard time. I think that a lot of people in this room can say that and know that the family members have to carry a lot along with them. So thinking about the dynamics, I tried to define the system there, but then let's try to think about the dynamics in the system that are sort of at play. So disappointment and loss, I want to talk about that for a moment. I think that when you have someone, let's say a child, this is, I guess, a woman, because I drew it as a circle, you have a child who's coming into the program, maybe it's a 23, 24-year-old woman, and they attempted to go to college a couple of times. It didn't work out. They were trying to get a job. They're having difficulty in their job, interpersonal problems, things that borderline personality disorder, for example, can cause difficulty in terms of interpersonal hypersensitivity, relationships, the job. So this person who's coming to us, this is probably almost definitely not what they expected their life to be looking like at this point. And I think that there is a lot of disappointment and loss at times when someone comes in that setting. But then when you think about it from the parent's perspective too, this is probably not what they expected either. Maybe they have another child who hasn't had the same sort of difficulties, and then they're sort of thinking along the same lines, how did we get here? Why? This is not what we sort of hoped we would be at this particular moment. So I think that is a reason why people are hesitant to come in. And then I think shame is also something that is pretty important to talk about and to put on the table. I think that when people come in, let's take the same example of that child. If it's not sort of where you thought you were going to be, I think a person in this instance might feel like, you know, a failure in certain senses. Why am I not succeeding at school in the way that my sibling did? And then when things are bad enough that sometimes people end up coming to a program like ours, an outpatient program that's pretty intensive, there's a feeling of, how did I get here? I'm in a mental hospital. This is not, again, what I sort of thought my life was going to be at this moment. From the parents' perspective, I think it's also hard, and shame plays a pretty big factor as well. There are questions like, how did this happen? You know, what did we do? What didn't we do? And this is a tough one. What did you do? And then when you put all of this on the table and then you say, let's draw a big circle around it and please come to my office and we'll talk about this and, you know, have a nice time, it makes sense that people are hesitant and cautious, and it's tough. It's tough and challenging work, but I think important work. And I'll try to explain why. So, before I do that though, when you take all of those things, these dynamics of disappointment, loss, shame, it's natural that people's defenses are going to kind of come up, psychological defenses. And I think that one thing that happens is that, you know, people, maybe it's the child or the young woman in this example, maybe it's the parents. I think there's a tendency, a very natural tendency, to be a little defensive. And this doesn't happen all the time. There's certainly times when I meet someone and I say, oh, I'm going to work with you in family therapy. And everyone is sort of on board and ready to go. I think what happens more often, though, is there's caution. And I think the defensiveness can sort of be like, I'm not really so sure I need to do this. You know, why don't you sort of work with our child? We're okay. And the blame, I think there's a real worry about, am I going to get blamed coming in, you know, and doing this type of work? And I think a denial of the importance of the family's impact. I think this is an important one. That when people, let's take a 25 or 30-year-old young man who comes into a program like ours. One thing that sometimes I will hear, I think others will hear too, is, you know, I'm not living at home anymore. My parents are over there. I'm sort of at a different place. And then the parents might say the same thing. You know, I don't understand why we have to do this. Like, you know, you have our child, they have this problem, you work with them. And I think that for everyone in this room who has been a child, and that's all of us, I think that you can look at yourself and sort of think about your internal experience and think, well, regardless of if you're 20, 25, 40, 60, or older, it doesn't matter. Your relationship to your family of origin, your parents, has an impact on your past. It has to. It has an impact on your present, to the degree you're knowledgeable about that, and it also has an impact on your future. And I think that sort of how we hold on to, you know, the experiences and our parents, siblings, it can really color interactions, whether it's with your family or workplace. So I think that it really has importance, regardless or not if people are still at home or not. But I think there's a wish that maybe we don't need to do this type of work, or maybe it won't be that necessary or helpful. So I hope that I've adequately tried to convince you, or adequately convince you of why I think that people are hesitant and cautious kind of coming into this work. And I'm going to try to move to why I think that it's a powerful and effective tool. So this is a quote that I really like. This is a man, Bessel van der Kolk, who's a trauma psychiatrist. So the quote is, "The roots of resilience are to be found in the sense of being understood and existing in the mind and heart of a loving, attuned, and self-possessed other." That's a mouthful, so I'm gonna read it again. "The roots of resilience are to be found in the sense of being understood by and existing in the mind and heart of a loving, attuned, and self-possessed other." That quote is, reducing that quote down, I think, is a real reason why this work is important and what one can get out of this work. So what I would say, taking that quote as sort of where I'm drawing this from, that the goal of family work is to help family members see and be seen accurately by a loving other. I think that that's basically at the heart of it, that trying to get that family system that I talked about before, all the different members of the family who sort of come in a lot of times in real crisis or difficulty, trying to help them see each other more clearly and be seen more clearly is really sort of the task that we have doing this type of work. So I'm going to try to use this and expand on it and help you and help convince you, hopefully, sort of what I mean. So let's take this family system again, sort of the simpler version of it, and let's. I'll go back. So we have the child there. Let's say they're 20 years old. So they're interacting with their mother and father for their entire life, and they're getting ideas of who is their mom, who is their dad, and excuse me, and they're internalizing that in a certain way. Whether that's internalizing that and thinking, I know who my mom and dad are. It's static. It's unchanging. I sort of got them covered. I know. Or maybe it's internalizing them in the sense that you end up hearing sort of the voices of your mother or your father in the way that you think. Or maybe it's, you catch yourself talking to someone, maybe your child, maybe a friend, and sort of thinking, that didn't sound like me. Like, who did that sound like? And you think, oh, that sort of sounded like my father, or that sounds like that was sort of my mother's voice. I think that there's a way that we sort of internalize our family, where we came from, in ways that sometimes we're conscious of, sometimes we're not. So the red lines there I'm trying to represent that the child in this instance is internalizing the mother, is internalizing the father, and sort of holding them in their head. And that's kind of how they are thinking about them. From the time that they're born up until the moment we happen to be interacting with them. But the child in this example isn't the only one who is internalizing. The father is also internalizing. So he's internalizing the mother or his wife, he's internalizing the child and sort of holding them and getting ideas of, this is who this person is. I sort of know who this person is. For the father, though, it's a little bit more complicated, because the father doesn't just have a child and a mother. The father was a child. So he had, and again, this is the simpler version, he had a mother and a father that he sort of internalized. It shaped his personality and probably shapes how he interacts with his wife and also the child. So to not make this too complicated, I just decided I would replace this by baggage. We all have ours, everyone in this room. And the child will as well be lucky enough to have baggage, and the mother does as well. So this is a complicated system, even in the simplest version of it. So going back to the quote, the goal of family work is to help family members see and be seen more accurately by a loving other. So the goal really is to try to get, so the light blue lines are basically what I'm trying to represent there is how people are seeing each other in the present. And the reason why it's light is because sometimes it's really hard to see each other accurately in the present. And the goal of doing family work is to help people get a better idea of who the other person is in the current moment, in the present, and try to shift the internal representations of that other person and see each other with more accuracy, which I'm trying to represent by blue. This is sort of who this person is right now. So I'm going to go through a couple of examples, which actually, before I do that, this might be a good place for me to stop for a moment and see if there are questions, because I'd like to go through two examples of what I am talking about here and how family work can be helpful. So I'll stop. Are there questions about anything I've talked about so far, or other things that people want to ask or interject? Okay. No? All right, I'll keep going. So impulsivity. I'm going to try to give an example around impulsivity. So for borderline personality disorder, impulsivity is an aspect of it. But again, this doesn't have to be someone with borderline personality disorder. It can just be someone who maybe has some other problem and is impulsive, to try to help generalize it. So, but in this example, let's just say the child is a young woman. Let's say that she is 20, and she has borderline personality disorder, and interpersonal relationships are really difficult. She has a lot of sensitivity around that. And she's in a relationship with a boyfriend. It's sort of hot and cold, on again, off again. And the boyfriend breaks up with her quite suddenly, and she is pretty overwhelmed and upset. And trying to get her perspective here, she feels alone, she feels upset, she feels just overwhelmed by it. So to try to manage those emotions, she ends up drinking. And she drinks and she gets in a car and drives and gets into a crash. Doesn't get seriously hurt, but the car is completely totaled. The police get there. They end up arresting her because she was intoxicated above the legal limit. And then they end up calling the father, who gets a phone call that he was not expecting. The first thing I imagine he feels is pretty anxious because, I mean, he had no idea that any of this was coming. He hears his daughter could have died, is in the hospital, is going to be arrested, confused, distraught. I'm going to guess probably angry too. I didn't put up there, but I think probably angry about, what is this? Where did this come from? Let's say that the mother is built a little bit differently, in sort of the fight or flight way. Maybe the father is more of a fighter when he gets sort of anxious and stressed, but maybe the mother is more of someone who goes into flight, gets overwhelmed. So I think the first thing I think she's probably going to feel is very anxious and worried, fearful, and overwhelmed. So opening it up, looking at what's happening in the system, this is what I think is happening in this sort of hypothetical situation. Now, looking at sort of the emotions of what each person is experiencing, it gets translated into action. So I've already talked to you about what the actions are that happen with the child. The young woman drinks, she ends up crashing the car. When the father ends up interacting with her, I'm going to guess that he may end up yelling because he's worried, he's anxious, and also upset. The mother, she may have a different response. She may end up withdrawing. She just doesn't know what to say and sort of pulls away. Now, the thing about this example is that this gives us a viewpoint of what's happening internally in each person. But we don't walk around with thought bubbles over our head. Mostly that's probably a good thing. So we don't really know. So let's actually take away the idea that we know what's happening. We don't know that the father's anxious and distraught. We don't know that the mother's feeling anxious, fearful, overwhelmed. We don't know what's happening with the child, that she's upset, she's feeling alone, she can't handle her emotions at this particular time. So instead, this actually represents reality, in more of reality, where we see a lot of actions, and sometimes in borderline personality disorder there can be a lot of actions that happen quite quickly. So we know that we have the child crashing the car and drinking, we see the father yelling, and we see the mother walking away. So what happens in this situation, because these different members are not really accurately seeing what's happening internally in the others, is you have to sort of fill in the gaps. You have to imagine, well, I see my dad yelling, why is he yelling? I don't understand it. So let's say the child is looking at the father and then starts filling in the gaps and says, well, why is he being so controlling of me right now? Why is he demanding of me? I just got in a car accident. He's such a narcissist. This is just what he does. Then the child looks at the mother and says, where did she go? Oh, she doesn't care. She's insensitive. She's just self-centered. This is really all about her. Now the parents are looking at the child's behavior, and they also don't have her internal world very clearly. I'm in this example, but they see the actions, and I'm going to guess maybe actions like this may have happened in the past, and they think she's so selfish. She's only thinking about herself. She's ungrateful. Couldn't she be more careful with the car? And she's reckless. So in this example, I just to stop and sort of think about this. This is, I think, when this family system that I'm talking about is really having a hard time seeing each other accurately. That what actually is happening, if we're looking at it more accurately in each particular person, this is their internal world. A lot of anxiety, a lot of fear, feeling overwhelmed. But this is, I think, when people are having a really hard time seeing each other's perspectives, what people can go to, sort of a reduction of trying to see actions that they don't necessarily understand well, and then what we all do in those situations. I think we put labels on, like, you're driving over here, it was not the easiest drive tonight, and if someone cut me off, I'm sure my go-to would be, oh, that, whatever. It would be a simple reduction as opposed to sort of a much more complicated way of understanding, oh, maybe they were busy, maybe they had to give a talk, maybe whatever. I think that everyone does this, but I think that in stressful situations, we are more likely to do it. So the idea of doing family work is trying to help flesh out in the room with different individuals where different people are coming from so that they can begin to see each other more accurately in the present. The other thing that I'll say, and I maybe should have said this earlier, I think there's a colleague who I know who has a saying about therapy, and I think we could think about this in family therapy, we could think about this in individual therapy. And the saying is, the goal in therapy is to help people realize that it's October 16th, 2014. That it's not October 16th, 2001. That it's not October 16th, 1975. But that it's actually, we are in the present day. And I think that in this example, really what you're trying to do in this type of work is to help people see each other more accurately in the present day. That of course what's going to be happening in the past, your past experiences, will color it, but the goal is to try to help people not have that coloring, make it so that it's so difficult to see each other accurately that people feel unseen and unheard. So, sorry, I wanted to jump to one other thing, which is, I think that in situations like this, sort of in a reductionistic way, people can kind of label each other, and it's really when they're having a hard time seeing each other. And this can lead to the assignment of roles. And I think when you think about those roles, in a family, I think you could think about, maybe with the family system where there are two children. There's the child, well, this is the child who is sort of more of a rebel. This is the one who's better at school. This is the one who ends up getting affected by a lot of these problems. This is the one that doesn't. There are a lot of roles that I think can end up happening in a family system that are not the whole picture. And I think doing work like this can challenge these roles and help people to see each other a little bit more three-dimensionally. So this is an example that I want to talk about. It's a heavier example of a suicide attempt. So in borderline personality disorder, another aspect of it is that people can, when they're feeling tremendously stressed, have suicidal thoughts or self-harm thoughts or have suicide attempts. And I think it's important to try to bring an example like this on the table and to help think through this. So in this example, I'm going to say that the father has borderline personality disorder, or if not, is just struggling with suicidality, maybe has something else going on. So to try to paint the picture, I'm going to say, let's say this father is in his 30s or 40s, he has a young son, and he gets fired at work. He didn't see it coming, he got fired at work. He ends up feeling despondent, becomes depressed, doesn't talk to his wife about it because the family that he came from, people don't really talk about those things. Maybe doesn't even tell her that much about what's going on, but sort of shuts down and keeps it all internally, and gets into a suicidal crisis. Now, this is how I'm illustrating a suicidal crisis, and to explain why. When people end up going into a crisis like that, where they're really seriously considering suicide, I think it's kind of like tunnel vision. That in that moment, they're not seeing their relatives, they're not seeing the people that they're attached to, the things that they're attached to, but it really just becomes more about feeling totally overwhelmed. And to try to think about what this father might be thinking about, just a tremendous amount of pain. Maybe feelings of failure for not being able to support the family in the way that he did in the past. And then moving to thoughts that I think are based on distortions, really going to, well, maybe they'd be better off without me. Maybe this is just, I would be doing them a favor, which there's absolutely no research at all that ever supports that. It's quite the contrary. Now let's open it up. And I put the father in black just to say, the mother and the child in this instance, the wife and the child, have no idea really what's happening with him. But they sense something's unusual, let's just say. They notice he doesn't seem like he's acting like his normal self. So they might become anxious about it and sort of worry. They might become kind of confused. Or perhaps they really have no idea, just because he's really good at kind of keeping things inside. So they're unaware of what sort of crisis this father is sort of into. So to take this example further, let's say that he has a suicide attempt, it was unsuccessful, but now people know that there's really a problem, and the shadow behind him is just sort of how I'm illustrating that there was an attempt. So in thinking about this, taking away the sort of his internal experience of being in pain, feeling like a failure, the family doesn't necessarily see that. That goes away. But they do see that there was an attempt, and they're trying to figure out, how did this happen? Why did this happen? And they're also not unaware anymore, because clearly something was wrong if this person did this. So when they try to think about, imagining what their experience would be in response to this, would be, I think, a lot of feelings of being scared, angry, I think. And then I think from the child perspective, something that happens not infrequently is feeling guilty. When parents are fighting, when something stressful happens, that I think oftentimes the child will end up taking on a belief or a wish that, they had more control, that maybe if they had done something different, that this wouldn't have happened, which is really more a wish than, I think, reality. Now, they might imagine, why did he do this, and go to things like, well, maybe he doesn't love us, maybe he wanted to leave us, maybe he'll leave us again. Maybe if I would have been a better partner or child, we wouldn't have been here. Maybe selfish, that he just did this selfishly. This was the last one I wanted to put on. I don't think this is the predominant thing, but I think that when there's a suicide attempt and someone either disappears or comes close to disappearing, it just causes so much fear and anxiety in everyone, and I think anger is something that does end up coming up in the people who are left to sort of grapple with, why did this happen? Now, just to go back, in terms of what his internal experience is, it's a lot of pain, it's feeling overwhelmed, feelings of failure, but it's difficult for the other family members to really understand it. And the goal in a situation like this, in terms of doing family work, is to try to help people see each other with more accuracy about why this happened, and to try to change the sort of ideas that they're bringing in and I would say projecting onto each other, and instead help them be able to see each other more accurately in the present. So just to go back to where I kind of started from, I think the goal of family work is really to help family members see and be seen more accurately by a loving other. And I think in this example, it's to find a way for the different family members to sit down from an empathic standpoint and try to understand, how did this happen? Where were you coming from? And then also have an opportunity to share, this is the effect it had on me, and to find a way for each of the different people to really be able to be open enough to hear each other's perspective, even when it can be sort of difficult and challenging, but to see each other accurately and be seen accurately. There are a lot of different ways to think about what is family work, and I think I left this towards the end because I think that it doesn't really matter so much what it is. It's just trying to get family members involved is probably the most important thing. The model that I was talking about, I think probably most correlates to family therapy, where you have a therapist sitting in the room and you're looking at the relationships in the present, in the here and now, and trying to understand what actually is happening right now. How much of this, the way that you're perceiving each other, is based on what's happening, or how much of it is based on what people are bringing in, the baggage that they're bringing into the room. That's important, but might be coloring their perception of the present. And it challenges old schemas and internalizations to try to differentiate between past and present. And again, I might be beating a dead horse here, but I think it's so important that it really is trying to help family members see and be seen more accurately by a loving other. Another way that one can think about family work is you don't necessarily have to be in family therapy, that there are things that can be done. Let's say if the parents in this example, let's say it's the child who's struggling with borderline personality disorder, there are things that the family members can do to really help in terms of creating a more stable, more calm environment. So, for example, there are these family guidelines which John Gunderson and Cynthia Berkowitz developed, and these are basically guidelines, and they're available on the NEA BPD website. They're guidelines around what can family members do in terms of, in their response when there are crises, their response to sort of emotional dysregulation or the sensitivity that might come up in borderline personality disorder, to keep the environment at home calm, to keep it cool, to basically just decrease the overall heat in the system and be able to make it so that there's more support, which I think my guess is that any family who has someone who is struggling with a problem like this really wants to provide, but it can be so challenging to figure out, what do I need to do to provide it? The saying is that we hear often, and there are books written about this, is I feel like I'm walking on eggshells. It's hard to know sometimes what to do, and I think there are resources that can help. So I hope this is quite an overview and fairly rapid, but I hope I've at least given an idea of why I think family work is a powerful and effective tool to positively affect family members. And there are different resources. As I mentioned, there are those family guidelines that are available on the NEA BPD website. There are other resources. At McLean, in the Gunderson Outpatient Program, we have a multiple family group that's starting, and that is for family members of someone who's in our program with borderline personality disorder, or actually not just in our program, any family members who have someone who's struggling with this. It's a group where the parents end up meeting together with in this case it's a psychiatrist, Dr. Karen Adler, and part of it is psychoeducation to help people figure out, what's happening in the situation, what might I need to do to help, sort of along the family guidelines way of thinking. And to some of it is, some of the best resources are really the other family members that are going through a similar thing, and just being able to sort of have them as resources can be really important, and the support that can also come from that is very important. And then, as Beth mentioned, Family Connections is a great program, and it's a 12-week program that also focuses to some degree on some of these skills. And I know that DBT is a big part. Dialectical behavioral therapy is skills like that are taught and can be very useful for the family members to have and to use. But it's also a family support type of model. So that's a really interesting question and a tough question. I think that it's one thing, and maybe this was sort of the easy version that I laid down, that someone's coming in, they're saying, I want help, we're saying, great, we'll try to help. But I think that if someone both has not been diagnosed, or if they don't really believe the diagnosis, they're not that interested. I think that there are resources for family members, even the family guidelines, that does not include any involvement of the person who's struggling with the disorder. It just basically gives you some guidelines for how to interact to keep things cooler at home. And I think coming to things like this makes a lot of sense, or other resources. I know DBSA, that's for depression and bipolar, but there are family groups that also, they meet here on Wednesdays. I can't remember the exact time, but there are resources for parents. But it's a difficult, or family members, but it's a difficult position you're talking about. So that is a tough situation. What I would say is that it makes me think about the difference between the content that you hear and actually what the person may actually be saying. And I think that one difficult thing, especially if you're hearing something like that, is you hear the content, back off, please stay away, I don't need you right now. And then it can be really difficult not just to say, what am I supposed to do, okay, as opposed to doing what is so difficult to do, but to try to do what we were doing here and sort of mentalize or think about the other person's perspective and what's motivating them to do this. And I would imagine a lot of situations like that, they might be anxious, They might be frightened. They might not have a language at that point to really talk about it. So I would say trying to keep doing a translation in your head to try to think, why are they doing this? And it might be fear, it might be being overwhelmed. And then trying to keep an empathic stance and be present but respectful to, if they really say we're not interested in having you be a part of the treatment right now, to respect that, but to sort of stay steady and to basically say, we respect that, but we're here, we're ready to engage when you are, we love you, and I hear right now you're not at a place where you're going to be able to engage with us, but we're here. But so to be respectful of the boundary, but to not necessarily listen too carefully to the content, especially of things that get more inflammatory, like I want you to leave me alone for the rest of my life. I mean, I think there are lots of things people say in the heat of the moment that I think don't reflect their real wishes, but reflect more what happens when people get into a really stressful fight or flight place. I can't speak about that specifically. What I would say is that in any stressful situation, and I think pregnancy is a stressful situation, if you have a problem like BPD, whatever behaviors you might have under pretty good control, it makes sense that they may come out. But that's well, I think the idea that I was stressing about a loving other, sort of empathic position. I think like if you were worried that any family member had any sort of illness, whether it's sort of mental health related or physical, and you felt like you were having some key to it that they weren't quite seeing, I think there is a sense to potentially trying to talk to them and saying, I'm worried about sort of what I'm seeing. I'm worried about, how things are going. I wonder about, I've read certain things about borderline personality disorder. I don't know that this necessarily is what's happening with you, but I wonder, does this seem like you can relate to different things in here? I think that if you're trying to get them involved, you need to be able to find a way for there to be buy-in. And that is really crucial to engage in any sort of process like this. And I think that it's a ginger process. And I think what I'm hearing from different comments today is that there are some people that people think, I have a family member, for example, not me, but just I'm hearing, there's a family member and this person has this, but they're not aware, or they've refused it. So I think trying to be gentle about sort of presenting it, and then if you're getting, resistance to it, if it's a very young child, you have certain control over them. But if it's an adult or a parent, you have limited control. So that's what I would suggest. Yes.
Can you talk about how BPD got its name? It's the worst name.
Sure.
And it
Sure.
feels like a very negative label.
Can I just say something related to that question of yours? Because this is, I think, there is a stigma issue.
Yeah.
There are a lot of people that will feel insulted by your diagnosing me, and so I think this is where description is better than a label. But and I want you to talk about it. But
Yeah.
the other thing, I think sometimes it's important for families to figure out what they can and what they can't do. Because I think as parents, often you're like, well, we're going to make this better, and other kids are suffering, and real wish to do it, which sometimes can come on as very too controlling. So sometimes just really thinking about looking at the situation, getting a consultation, and just kind of thinking about what's possible and what isn't, and what you accept. And if you can make those changes yourself, other things can follow. But sometimes people try too hard, and it actually is most unhelpful for people who have this kind
What kind of consultation do you have in mind?
Well, just with, people who work with, where people
I was
must
just
all.
gonna say, but in the Family Connections, if you are in the Family Connections class, over the course, it's pretty dramatic, but over the course of 12 weeks, I think there's a big difference between going to a support group where you get support alone And so where, you know, you feel supported and everyone is helpful in that way. But there's a marked difference, I think, in going to a group where you can actually learn and even more so practice skills for yourself to be able to do the things that you're talking about trying to do, which involve first building a relationship where there may be none at all, and then learning how to speak a language so that you can communicate with the person you're trying to communicate with, sort of on their planet, because they in some sense, you know, we talk about them being they're on one planet and you're on a different planet. They're not going to come to your planet, and so you need to be able to go to their planet, basically. And those are the kinds of things that you have to learn and practice in a safe environment. And that's what happens in the class. We practice with each other. And over the course of that time, you can learn skills that will help you accept the things that you may have to accept, and then also maybe move towards whatever change is possible in your situation.
Also, I would say unless you're a professionally, person who has, the knowledge to diagnose someone, I personally wouldn't go on out on a limb and say, oh, by the way, you have these characteristics. I think it would probably be one of the worst things you could ever do, in my opinion, based on my experience,
Yeah.
which I've never done.
That's what I've read. Everything I've read says don't tell them.
You said one of the concerns was the husband didn't buy into it, or it was kind of, this is what I think, what if you just said to the husband, this is the book, the little pamphlet on the criteria that Gunderson has is about 20 pages, just read it and think if that's a possibility. That way there, you're not pushing anything, just read it and see if you possibly see that.
Which
That there, BPD agreed, there are two pamphlets, but we might want to get to I felt badly I cut off this question about the diagnosis.
Well, I think that the stigma question is really important, and I'm glad you put it on the table, Maureen. I think less important. Is it borderline personality disorder? Is it not? Does the person have aspects of it? I think if there are enough aspects of it that a person has, what is really wonderful is that there are some very effective tools. So to just basically, I would say I would try to get less stuck in sort of the diagnosis of you have this, you need this, and more trying to sort of look at what you're seeing, and if it seems like it's close enough, there might be tools like the Family Connections that Beth has been mentioning, or other things like this guideline. How borderline personality disorder got its name is just a fairly simple story that many years ago, and this is just sort of paraphrasing it, but when they were trying to look at the difference between neurotic problems and when people have psychotic problems, that they found that people with neurotic problems, and I'm defining that just sort of as, a lot of worries, anxiety, maybe distortions in terms of how you're viewing relationships, that when those people got really very, very stressed, their thinking could become more psychotic. Their thinking could be more confused, more overwhelmed, paranoid in certain instances, and so that it was defined as sort of the borderline between neurosis and psychosis. That's a historical sort of note for you. At this point, I would say the way that it's really just used is that it's been seen as these symptoms cluster together, and as a result of that, there are these treatments that have been developed for it and that are effective, and that's sort of what I think is probably more important. But historically, that's how it came to be. That may be the case. I'm not sure. The DSM-5, the Diagnostic and Statistical Manual, was revised recently, and there was a lot of talk. Actually, John Gunderson was involved in that talk, but they ended up, the whole personality disorder structure in the way that book was designed was potentially going to change, but it didn't. So I'm not aware that it's going to be changing. But again, I think you're bringing to light that the term has garnered a sort of negative connotation, not all that different than narcissistic personality disorder is a real disorder, but people say you're a narcissist, and it's sort of they use it as an insult in a certain sense. So there's a way that it's sort of made its way into the lay public in language that I think is probably pretty unhelpful to people who have these issues.